What symptoms differentiate a cold from the flu? Imagine catching a sudden wave of illness that hits you out of nowhere. That's often how the flu begins, with symptoms coming on quickly and intensely. In contrast, a cold tends to sneak up gradually, with milder signs that build over time. When it comes to fever, the flu usually causes a high temperature that lasts for about 3 to 4 days. Both adults and children often experience this fever. On the other hand, a cold rarely causes a fever in adults, though children might have a mild one. Muscle aches and fatigue are common with the flu. You might feel body-wide soreness, headaches, and tiredness that can linger for days or even weeks. Cold symptoms rarely include muscle aches or severe fatigue. Instead, they often bring a mild sore throat, a runny nose, and sneezing. Coughing with the flu tends to be more severe and dry, while cold coughs are usually milder and more productive. Sneezing is quite common with colds but less so with the flu. Chills and a sense of weakness are typical signs of the flu. You might feel shivering and drained, making it hard to get through your day. These symptoms are less common or mild when you have a cold. The duration of symptoms also differs. Cold symptoms usually last about a week, and most people recover without complications. The flu can last longer, sometimes several days to weeks, and in some cases lead to serious issues like pneumonia, especially in vulnerable groups like the elderly or those with chronic health conditions. Understanding these differences can help you decide when to rest at home or seek medical care. Recognizing that the flu hits hard and fast with high fever, muscle aches, chills, and fatigue, while colds tend to be milder with slower onset and less severe symptoms, is key. Always remember, if symptoms worsen or if you belong to a high-risk group, it's best to consult a healthcare professional for proper diagnosis and treatment.